Hey, Dr. T here with PEAK Integrative Medicine, and let's talk about IBS, also known as Irritable Bowel Syndrome. So, if you've ever gone to the family doctor and maybe you've gone on to see a gastroenterologist and you have stomach pain, bloating, constipation, diarrhea, acid reflux, or a little bit of all the above, chances are you've been diagnosed with IBS. And IBS is basically a diagnosis of exclusion. So, what does that mean? It means that they've ruled out the big bad ugly stuff, so things like ulcers, bleeds, polyps, cancers, etc., but yet you're still having the symptoms. So since they didn't find anything specific, they label it based on the constellation of symptoms and having them for a certain period of time, and that's how you end up with a diagnosis or label of IBS. The problem with that is it doesn't really give us any idea or doesn't tell us about what's causing the IBS, what's the root cause. And usually people have one or more of the following common 7 root causes of IBS. And those are things such as yeast overgrowth, food intolerance, leaky gut syndrome, parasites, heavy metal toxicity, zinc or magnesium or other nutrient deficiency, and something called SIBO or small intestinal bacterial overgrowth. So let's dive into these root causes a little bit more. And perhaps some of these you might see that apply to you. And sometimes we don't know, so we do testing. But let's talk about each of the 7 common root causes of IBS. So the first one is yeast overgrowth. So yeast is found in a lot of foods. It's found in the environment. And when conditions are right, or in this case, wrong, then they can start to grow. These yeasts can grow in the gut, can grow all over the body, really. So if you have any symptoms of like thrush or white covering on the tongue, you may have candida. If you have around the genital area, a lot of itching, around the anal area, a lot of itching and irritation, that could also be signs of an external yeast overgrowth. But a lot of times these things are under the surface. They're in the gut, especially the large intestine. And we all have yeast, bacteria, and different things growing in our guts. But when it becomes to be excessive and starts to take over our microbiome or our normal makeup of bacteria and yeast and other organisms, then it becomes a problem. And things that feed yeast are high sugar diets, or maybe you don't eat a lot of sugar, but you eat a lot of refined carbohydrates or simple sugars. So these are things like breads, pastas, cereals, grains. Even if you tend to do like a lot of fruit smoothies, you might eat healthy, but a lot of fruit smoothies, a lot of sugar can feed into this problem and make things worse. So one root cause that we want to look at and then address, if present, is yeast overgrowth. The next one is food intolerances. So when we eat certain foods, and the most common one that most of you have heard of is lactose intolerance. So that's your body's inability to break down lactose or milk sugars. So if you consume dairy and it gets into the intestines, especially large intestine, and we can't break that down, then that starts to draw in water from the surrounding tissues and can cause diarrhea, can cause a lot of bloating and discomfort. So some people go through most of their lives not realizing they have this, but they have IBS type symptoms for many, many years. And then when they remove that from their diets, they feel a whole lot better. Now, lactose and milk dairy is only one of these intolerances. It could be gluten, it could be beans, it could be many other foods. So we can either avoid these foods for a period of time and see what the symptoms are like when the foods are removed, or we can do testing and see what's not agreeing with your body perhaps, and then avoid those foods. And oftentimes we'll see those symptoms go away. So that's the second possible root cause, is food intolerances. The next one is something called leaky gut syndrome. So in the gut, there's a couple different, I guess you could see, areas of the gut or layers of the gut. So the first is the inside of the tube. So that's like would be if you're looking down a hose, it's the inner part of the hose where the water flows. So for us, that's where the food is at. And we can get other things in there. We get food material, partially digested, fully digested foods. We can get bacteria, yeast, fungus, parasites, a variety of things. So that's in that first area inside the gut. Then we have what's called the mucosa layer. So if you're looking at the inside of that hose, on the inside, if you can imagine there's a protective layer there, that's the mucosa layer of the gut. And that prevents food and other things from interacting with the next layer, which is, I guess you can call it the skin of the gut. So that is the actual barrier between the inside of the gut and then moving outside of the gut into the bloodstream. So there can be a breakdown in any of these areas. So usually it starts first with we don't have enough good bacteria, or we eat foods like we talked about earlier about food intolerances. That causes an irritation. It causes a breakdown in that mucosa layer. So now more things can touch the skin of the gut or the surface of the gut lining. And then now when it does that, especially certain foods like gluten, for instance, is a common one, we start to get irritations on the wall of the gut, and then it starts to break down that lining. And the problem with that is the gut is like one big filter. So the analogy I like to use is a screen in the window. So we have a nice day in the spring. We want to let fresh air in, but we don't want to let bugs in. And we don't want to let other things get in through that window. So the screen is there to let the air in, but not let the bugs in. So in the gut, that layer, the skin of the gut, is when that starts to break down, those holes in the screen start to get bigger. So now it's like taking a screwdriver and jamming that through the screen. So now we're letting air in like we want, fresh air, but now those holes are larger than they should be. So now other things can get in, mosquitoes, gnats, flies, etc. When that happens to the body, it's kind of like what happens in the room here. If I get a bunch of flies in here and I start swinging around, then I can start knocking things over and start causing some damage. In the body, the immune system does that. So the immune system sees things that shouldn't be there, starts to go on the attack, and that creates an inflammatory state and then can start to cause issues all over the body, really, but especially at the level of where it's all happening at the gut lining. So then that can cause some irritation. It can cause some pain. And then if the mucosa layer is broken down, it creates an unfavorable environment for our healthy gut bacteria to thrive, and it just throws off the way the gut functions. So that's root cause number 3 is leaky gut syndrome. We can also call it increased intestinal permeability. Those gap junctions, those holes that are supposed to let nutrients in but keep everything else out, they get too large and then starts to cause all of those issues from happening. Next root cause is parasites. So a lot of people think parasites have to be things like tapeworms and roundworms and things that we can see. So if we're checking our bowel movements and we don't see things, we're like, oh, I don't have parasites. However, there are many microscopic parasites as well, the size of bacteria. So we don't necessarily see them, but yet they can cause issues. So a common one that we see, at least in our area, is Giardia. And it usually comes from drinking or being exposed to contaminated water. So if you ever went camping out in the wilderness and a stream is there and the water looks really fresh and clear, don't trust it because upstream, you don't know what type of animal is using that as their bathroom. So that's where we often get the Giardia. And then that can cause things like diarrhea. It can cause things like bloating, stomach pain. And I know personally, I've had this myself, and I had it for quite a while until I tested and found it. I didn't realize anything was majorly wrong because it wasn't that bad. But yet I had loose stool and gas on a regular basis almost every morning. And but once I treated it, all that went away. And then I realized really how much I was suffering. So parasites are another potential cause that aren't really always tested for in conventional medicine. So it's one thing we make sure we look for here, especially if someone's coming to us with longstanding gut issues. The next root cause is heavy metal toxicity. So heavy metals are all over the place. It's in the air, in the environment. If you live next to plants, and it's putting out through the stacks. If you're drinking contaminated water, maybe you drink from a well and there's something that was there in the past that contaminated that well. We really get exposed to these heavy metals all over the place. And for some people, it's hard for their bodies to get rid of it because of genetics and other factors. So heavy metals are a problem and can cause gut issues because bacteria can use these metals to create biofilms, which then protects it from the immune system and our own immune cells. It can protect those bacteria from even antibiotics. So you can be sick, you can get an infection, you can have IBS, and they try to use antibiotics to help get rid of the excess bacteria or the abnormal or pathogenic bacteria in your gut, but it doesn't work as effectively as it should, and those bacteria remain there long-term, causing long-term IBS. So then we have to use certain treatments to help get rid of those heavy metals and then help build the gut health up so that it takes care of that issue. But heavy metals can definitely cause problems in the gut, and that's one of our other root causes of IBS. Next up is zinc, magnesium deficiency, or I would say a variety of other nutrients as well. But zinc and magnesium, using as an example, and zinc is used by the gut to help with intestinal barrier integrity, modulation of the gut microbiome. So it affects our healthy gut bacteria and does something with our immune system so that it can fight off foreign invaders. So if you have a zinc deficiency, it could lead to problems in the gut and cause some of these other problems that we're talking about. Magnesium is involved in smooth muscle function. So smooth muscle is the muscles that help kind of push things through our digestive tract and create those peristaltic waves to help move food through. And it helps control inflammation in the gut. Vitamin D has some function there as well with the immune system and with neurological function. And there's a variety of other nutrients that I'm probably missing that can affect gut function as well. So nutrient deficiencies, especially zinc and magnesium, are something that can cause IBS. And finally, the last root cause that we'll talk about today is SIBO or SIFO. So SIFO is small intestinal fungal overgrowth, and SIBO is small intestinal bacterial overgrowth. So we talk a lot about the microbiome and the healthy gut bacteria that should be found in our guts. And most of those are found near the end of our digestive tract, so in the colon. But what can happen is if you eat the wrong foods for your body, you're eating unhealthy foods, if you have poor overall digestive function, so you're not producing enough digestive enzymes, if your stomach acid is low, if your gallbladder is sluggish, it doesn't keep especially the small intestine, sterile enough. So really there shouldn't be hardly any bacteria in the small intestine at all. But when the conditions are wrong for a body, then those bacteria can start moving up and populating the small intestine. And once they get up in there, they're in an environment where now they have more access to fibers from our food, for instance. So usually our fibers, we break it down, we digest it before it gets down to our colon, where bacteria would start to feed on it and then potentially produce gas and then bloating. But if the bacteria move up in the small intestine and there's still fiber present before we get to fully digest it ourselves and before we absorb it, then that fiber is now there for the bacteria to digest. And whether it's good bacteria or bad bacteria, it's in the wrong spot. It's getting those fibers, it's fermenting them, and it's creating gases like methane, for instance, and sulfur. So that can start to affect the way the gut functions, and that can cause constipation. And if it's constipated long enough, it's not moving through, the body can have the opposite effect and cause diarrhea. So then a lot of people will go through these alternating episodes of constipation followed by diarrhea, and then back and forth. And all the while, bloating can occur. And usually when we see SIBO, it's within an hour or so after eating, because it gets to those areas of the small intestine pretty quickly and then can create that gas. Versus, like, say, if you had really bad gas many hours later after you eat, that could be more of a large intestine issue. But with SIBO, there's bacteria in the wrong spots, or there's an overgrowth of the wrong bacteria and can cause those symptoms leading to IBS. So the key takeaway is that IBS is just a label. It's a label for the constellation of symptoms that you're having, and it doesn't tell us much about the root cause. So what you really want to do is have testing done, find out what's the root cause for your IBS specifically, and then treat those issues if you ultimately want to have a resolution of symptoms and have a resolution of symptoms long-term versus a temporary fix like you might get by treating the symptoms with medication. So if you're constipated, you have a laxative, which can help move things through, but do you really want to live on laxatives the rest of your life? Probably not is the answer. So get to the root cause of your IBS. And if you need help, you can contact us at peakintegrativemed.com. And if you want to schedule a free discovery call to talk more about your specific situation, you can go to gopeakmed.com to set up that free phone call.